Hello everyone. Today we are going to continue with the remaining part of normal newborn care. In the last video we have seen up to immediate newborn care. In the today's class we are going to see about the other daily care and observation of newborn. The first point is, see, whatever we have studied till now, that is immediately you have to do, and these are the care that we have to do daily basis. The first one is check the vital signs of the baby. That is the normal things for everyone. Okay, then weight is to be checked daily and evaluate according to the birth weight, and weight loss is normal in the first few days, but more than 10% of body weight is loss is abnormal. Most of the baby gain weight within 7 to 10 days. Thereafter the weight gain rate is 150 to 200 gram per week. So what happened? First we'll check vitals, second we are going to check weight daily. Okay, and how we'll calculate? It's based on the birth weight of the baby, and like 10% of body weight there will be a loss. Okay, it is not like compulsory that if baby born 2.5 kg, it will be 2.5 kg only. There is a chance of loss also. Okay, 10%, and after that, like within 7 and 10 days, it will start to gain the weight, almost 150 to 200 grams per week. And look for any skin color changes such as cyanosis and jaundice. Okay, so you know that what is the meaning of cyanosis? That is bluish discoloration of the skin because of lack of oxygen in the blood. Okay, or jaundice is yellowish discoloration because of increased bilirubin level in the blood. So that also you have to observe. Next one is feeding status of the baby. Have to be assessed amount of feeding, difficulties of feeding. As we know, after delivery, if it is in normal case, within 30 minutes we should initiate the feeding. So you have to assess it, how much amount of feeding the mother is giving to baby, and is there any type of difficulties the baby or the mother is facing. Okay, head is assessed of any depression or bulging of fontanelles and resolution of CAPUT, SUCCEDANEUM and the molding. Look for the umbilical cord for drying and any presence of sepsis. Next one is observe the baby for elimination, any constipation and loose stools or sore buttocks. Observe the color of urine. Frequency of passing urine is noted for first 24 hours. Next point is cleansing of the skin may be done daily or as frequently as required. Parent-infant interaction is much needed. It develops the love bond between mother and baby. So next we will start with physical examination. Still we have studied about the introduction of normal newborn, and we have seen what is the immediate care for normal newborn and what are the daily care for normal newborn. So today we will continue with the physical examination for the normal newborn. The first one is vital signs. So check the vital signs in the following orders. First one is respiration. Normal value of respiration is 40 to 60 breaths per minute. Next we are going to check the heart rate. The normal value of heart rate is 120 to 140 beat per minute. Temperature. The normal value of temperature is 36.5 to 37.5 degrees Celsius. Next we are going to check the anthropometric measurements. It means height and weight. Okay, so first we are going to see the length. The crown to heel length with infant supine upside down with the knees slightly pressed down to obtain the maximum leg extension. If you see this picture, you will notice from here it is called crown to heel. So when we will check, we will just slightly press the knee, so we will get the optimum measurement. The normal length or height of the baby is 47 to 50 centimeter. Next we will see head circumference. It is measured with a tape measures drawn across the center of the forehead and the most prominent portion of the posterior head. And the normal the measurement for head circumference is between the 33 to 35 centimeter. If you see this picture, you will come to know that how we will check the head circumference. Okay, in the forehead with the help of inch tape. Next one is chest circumference. It is measured at the level of nipple and is about to 2 cm less than head circumference. So the normal head chest circumference is 30 to 33 centimeter. So it is like almost 2 cm less than the head. And this is the picture how we are going to measure it. Next is weight. The average birth weight is 2.5 to 3.5 kg. Next one is skin. So in the skin, what we are going to check? First one is we are going to check the color of the skin. The most term newborn have a ruddy complexion because of the increased concentration of red blood cells in the blood vessels and decrease in the amount of subcutaneous fat. This ruddiness fades slightly over the 1 month. So in the color, first we will see what there is a color of ruddiness, like a redness because of increased RBC. Okay, within 1 month it will subside. Next we will go for cyanosis, like peripheral cyanosis and central cyanosis. As you know that is bluish discoloration of the skin. So it appears due to immature peripheral circulation, and this is normal phenomena in the first 24 to 48 hours after birth. And central cyanosis is indicate decreased oxygenation, and it may be the result of temporary respiratory obstruction or an underlying disease. Next, we are going to check the vernix gaseosa. It is a white cream cheese-like substance that serves as a lubricant, is secreted by the fetal sebaceous gland and which disappear within a few days. So this is called as vernix gaseosa. Okay, and it is secreted by fetal subcutaneous gland, and within few days it will disappear. Next is Lenogo. It's a fine and downy hair that covers a newborn's shoulder, back, and the upper arm. It may be found also on the forehead and ears. Preterm newborn has more Lenogo than the postterm. It's like small hair over the baby's body. Next one is decomitation. Is the feeling of the skin takes place few days after birth and the most mark on the hand and feet. It is peeling of the skin. Okay. Next is milia. Newborn sebaceous glands are immature. Thereafter, pinpoint white pupils can be found on the cheek or across the bridge of the nose of the newborn. It disappears by 2 to 4 weeks. This is called milia. Next one is erythema toxicum. It began as a papule and increasing in sensitivity to become the erythema by the second day and the disappearing by the third day. After the skin, we are going for head. First, we'll go for vital signs, then anthropometric measurement, then we'll go for skin color and all, then we'll go for head. A newborn head appears disappropriately large because it is 1/4 of the total length. Fontanelle. The anterior fontanelle will be felt as a soft spot, and the posterior fontanelle is small that it cannot be palpated readily. Next one is CAPUT succedanum. Swelling or edema of the presenting portion of the skull, that is called as CAPUT succedanum. Okay, and it goes away within few days. So while delivering, if there is any swelling or edema in the presenting part means during delivery which part is coming first. Okay, that is called as presenting part. It may be head, it may be buttocks. Okay, so in case of head, if there is any pressure on that and it may cause the swelling and edema, that is called as CAPUT succedanum. Next is CEPHALHEMATOMA. Bleeding between the skull and the periosteum of newborn baby and secondary to the suture of blood vessels crossing the periosteum. It does not cross the suture line, disappear by weeks and months. So whatever we are studying, these all are physical examination and that doesn't needed any type of treatment. Okay, it is normal for normal newborn baby. So today we will be going to study up to the head only. Okay, remaining physical examination we will study in the next class. Thank you everyone.